Okay, so this is a PowerPoint that you had posted called Vital Signs in Some Labs. And the reason I post this for you guys is because you're brand new into this nursing thing and you don't always, or you need some guidance on how to make decisions. Okay, so this is my attempt to give you some guidance on how to make decisions. And if you don't have all of this up for taking notes, don't freak out. It'll be okay. I'm recording. And a lot of it you're probably already going to know, okay? And you probably don't need to take a whole lot of notes. So what a normal temperature is posted up there, and you need to think about what are you going to do if it's too low or too high. And so my attempt to give you some guidance on that. Is it too low? Okay, well, did they drink ice water? Are they cold? Are they receiving cold IV fluids? So ask yourself a few of those questions. If they just drank some ice water, wait 15 minutes and retake it. And then if it's better, then great. Record it and move on. If it's still low, tell somebody. Tell your nurse, tell your doctor, tell your instructor. If your temperature is high, you're worried about infection. Okay, so you want to think to yourself, does this patient have a diagnosis that indicates they have an infection? Have they had a fever before during this stay? Is it new or old? You're trending it to see if it makes any sense to your patient. If it's new, notify the doctor. If it's not new, watch it. If it's not new and you have a Tylenol order, give them Tylenol, okay? If they've had a blood transfusion, a fever is a big deal. You notify the doctor. If they are post-op, and when I mean post-op here, I mean immediately, within an hour out of the operating room. If they have a temperature spike, we worry about malignant hyperthermia. So that's a genetic condition, runs in families. Not very many people have it, but it's very serious if it occurs. Okay, so some decision-making tree there. Next, vital signs, pulse. What do you do? Let me close that. That's a little bit better. So if it's between 60 and 100 and it's a regular rhythm, meaning it's bum, 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 bum versus bum, 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 right? Okay, that's fine. Chart it. Except if their vital signs are their pulse is between 60 and 100 regular and they feel rotten. So if I'm weak and dizzy and my pulse is normal, you still have to do something about it. So what if my pulse is too low? If it's less than 60, think about why is it low? Am I taking medications that cause it to be low? Have you looked at my labs? Is my potassium level too high? Do I have an arrhythmia? And if I have an arrhythmia, did you know it before now or not? Any of that's new, you notify somebody. If they have a pulse over 100, you have to think to yourself, why is it over 100? Do they have a fever? Are they infected? Are they under stress? Do they have anxiety? If any of this is a new symptom, you'll need to notify someone. Okay? See, it's not rocket science here, but it just helps you to clarify. So respirations. 16 to 20 is like the book normal. If it's less than 16, get an oxygen saturation and think about why would it be low? Are they taking opioids? Are they recovering from anesthesia? If they're in your ER, did they take street drugs? Are they taking Xanax or a benzodiazepine? Once you ask yourself those questions, you have to do something about it. You can't be like, oh, it's 8 respirations of 8 and you took street drugs, okay, and walk out of the room. So you have to do something, stimulate them, raise the head of the bed, give them oxygen, notify somebody. If it's greater than 20 respirations per minute, get a pulse ox and ask yourself what's going on. Are they in pain? Do they have anxiety? With those things, you could maybe give a pain medicine or calm them down or give them anti-anxiety medicine. Are they having trouble breathing on top of having high respiratory rate? So tachypnea along with dyspnea. So how do you know if I'm having trouble breathing? I start using my intercostal muscles, or these muscles around my ribs and my clavicles. I hunch forward, I'm tripoding. I'll automatically sit myself up. Encourage the patient to sit up, take some deep breaths, listen to their lungs, get a saturation, call for help once you know what's going on, okay? So the things you're looking for normal range is still the depth and regularity of breathing, symmetry, work of breathing. So work of breathing means when I'm sitting, you guys are sitting here breathing, I don't actually see anybody who's having any trouble breathing. Their work of breathing looks normal. It's restful, easy. But my work of breathing is increased if I'm leaning forward and I'm really actively working. I have to think about breathing, okay? Next, blood pressure. So if it's, blood pressure is 120/80 is about the normal. But there's a wide range. You can be below that or above that and still feel okay. So if blood pressure is less than 100/60, think about your patient. Is it a normal for that patient? Was it the wrong size cuff? Because you guys learned about cuff size causing trouble with blood pressures, right? Are they weak and dizzy? Have they had narcotics? What do you need to do? So if my blood pressure is low, you have to think about keeping me safe. So you don't want me standing up. You'll probably lay me flat. And you want to make sure my brain is getting perfused with blood. And it's harder to perfuse my brain when I'm standing up or sitting up. So when your patient's got a low blood pressure, you lay them flat. Or you could even lay them with feet in the air and head down, called Trendelenburg when you're laying like that, depending on what your patient needs, right? Because you always want to keep perfusion to the brain and the vital organs. If your patient's blood pressure is low, you need to think about a few things. Did you give them opioid so their baroreceptor reflex was stunted? Are they vomiting? Are they lacking body fluid? Hypovolemia? Are they post-operative, so they're hemorrhaging somewhere, losing blood that way and with having hypovolemia? Okay? You're thinking about all these things, considering them, and calling the physician based on your findings. And then again, if it's too high, what we're really worried about for too high blood pressure is stroke, right? We want to know, are they taking medications that are causing their blood pressure to go up? Do they have too much fluid on board, like in heart failure? Are they a victim of trauma, right? If your patient's got a high blood pressure, you want them sitting upright. If you lay them flat when they have a high blood pressure, you can cause pressure in their brain. Okay, you don't want any extra pressure in your brain. So we're going to sit up high blood pressures and lay down low blood pressures. Yes?
If your patient's blood pressure is low but they have like a trach in, what should you do then?
I would maybe just go almost flat but not completely flat. So that's a good question. As flat as you can go safely with breathing. Okay, blood pressure making sense, you guys? These are normal labs. I already talked about the CBC already, so I'm not going to go over it a whole lot. But this slide is posted for you to know what normals are. For this class on antibiotics, you need to know total white blood cell count over 11,000 is high. And you need to know that a left shift of increased neutrophils is indicative of bacterial infection. White blood cells over 11,000 is considered high, and neutrophils with a left shift is indicative of bacterial infection. And this next slide just has you a printout of what a differential might look like, where it has the total number of neutrophils, eosinophils, basophils, etc. Right, so this might be something that I would post is actually this graphic on your exam and have you look at it and tell me whatever the question asks you. This is an example of that left shift and what that means. So with the left shift, these are neutrophils, and so these are bands or immature neutrophils over here, and more neutrophils or older neutrophils as you go over. A severe left shift means you have a lot of bands or immature white blood cells because your body is gearing up to fight a big fight. This is just an image of what a blood culture tubes would look like. So if you had a patient who had severe fever and you were worried about sepsis, and they said to get blood cultures, you'd wear a mask. You'd clean off the site with alcohol and chlorhexidine, let it dry. You don't wave or blow on it because that produces bacteria, and didn't do a clean stick. And you fill up the aerobic tube and the anaerobic tube. Send that to the lab.
You said you clean it with alcohol and what else?
Chlorhexidine. The question was, what do you clean it with? It was alcohol and chlorhexidine. So the idea for this is you want to get rid of all of the bacteria on the skin, so when you puncture through, you're only getting bacteria actually in the blood. So when I get blood cultures back that have a lot of Staphylococcus aureus growing in it, it makes me think that it was probably a dirty stick. And we got skin bacteria in the sample, right? All right.